Hello, my name is Piawoh Bujung.
My name is Jesica Burke.
And my name is Tylin Siwemuke. We are medical students at the Medical College of Georgia, and we want to fill you in on fasting guidelines before your procedure or operation. Proper preoperative fasting is crucial for reducing your risk of pulmonary aspiration, which is a potentially life-threatening complication where your stomach contents travel towards your lungs.
Understanding the guidelines of preoperative fasting is essential because inadequate fasting before your procedure can increase your risk of pulmonary aspiration after administration of anesthesia, during your procedure, or in the immediate postoperative period.
First up, we have recommendations related to clear liquids, which include water, black coffee, black tea, juice without pulp, and soda. Consumption of clear liquids should stop at least 2 hours before your procedure. It's important to note that alcoholic beverages are not considered clear liquids, and that coffee and tea must remain milk and cream free during this period, but more on this later.
If the patient is a breast milk consuming baby, fasting should begin at least 4 hours before the procedure. And for those who take infant formula, fasting should start 6 hours before the procedure. Ensure you follow these timelines for the safety of your child. For patients who consume non-human milk or dairy products, fasting from these items should start 6 hours before the procedure. This rule applies to those who enjoy their coffee or tea with a touch of dairy in the form of milk or cream.
With regard to preoperative fasting, solid foods are categorized as either light meals or fried and fatty food. If your diet includes fried or fatty foods, fasting from these should start 8 hours before your procedure. This extra time is necessary to ensure your safety during the operation. Official guidelines suggest you begin fasting from light meals, like toast with a clear liquid, at least 6 hours before your procedure. But because there's no clear distinction as to what determines a meal to be light, it's probably best you fast at least 8 hours after you eat any solid foods to be extra safe.
While your doctor will tell you what medications you should and should not take in the preoperative period, one class of drugs in particular is worth mentioning in this video because it's increasing in popularity and its guidelines were recently updated. GLP-1 agonists like Ozempic and Trulicity are anti-diabetic medications that may cause pulmonary aspiration during surgery.
As of the production of this video in 2024, the official American Society of Anesthesiologists guidelines indicate that those who take GLP-1 agonists once a day should not take the medication on the day of surgery. For those who take the medication weekly, you should stop treatment a week before your procedure. Remember, this is a new medication that is currently undergoing research, so these recommendations are subject to change.
To sum it up, following these fasting recommendations is essential to reduce the risk of pulmonary aspiration and ensure a safe and successful medical procedure. Always follow the specific instructions provided by your doctor.
Thank you for watching our patient education video. We hope you found this information helpful and it contributes to a smooth and successful medical procedure.
These recommendations are based on the American Society of Anesthesiologists practice guidelines for preoperative fasting, are intended for healthy patients of all ages undergoing elective procedures, and may not apply to you if your procedure is done with no anesthesia or with only local anesthesia.
For more information or recommendations before your procedure or operation, please visit the American Society of Anesthesiologists website. You can find the link to the organization's homepage and the specific preoperative fasting recommendations in the video description below.